All right, so this is the first of the lectures about the thigh, and in this lecture we're going to be talking about the osteology and the muscles of the thigh. So to start us out with the osteology, we're actually going to cut here to the skeletal model. All right, so here on the skeletal model we have a posterior view of the left femur, and just to orient ourselves again, here's the head of the femur, the neck of the femur, greater trochanter, lesser trochanter, and then here is the shaft of the femur, which is relevant for the thigh region. The shaft connects the femoral neck, so up here, the femoral neck, and it runs all the way down and connects to the two femoral condyles down here. The femoral condyles are what articulate with the tibia to form the knee. The femoral shaft, or you could say the femur in general, is the longest and thickest bone in the body. One thing we want to point out here is the linea aspera, which is this ridge you can see right here on the posterior surface. It contains a lateral and a medial lip to it. And these serve as attachment sites for many muscles in the thigh region. And then they also serve as the attachment site for the three intermuscular septum that separate the three thigh compartments. All right, so we've zoomed in here to show you the pectineal line. And the pectineal line runs from the lesser trochanter here, and it's this bony ridge running down here to the medial lip of the linea aspera. And it serves as an insertion point for the pectineus muscle, which we'll talk about in a few slides here. All right, so this is a zoomed in posterior view of the left knee. So we're focusing on the distal femur here, and specifically the medial condyle right here. And what we want to point out is this bony structure right here called the adductor tubercle or adductor tubercle, and it's a small prominence, as you can see here, on the proximal area of the femoral condyle, and serves as an insertion point for the adductor magnus muscle, which is a muscle found in the medial compartment of the thigh, and we'll talk about more in depth in a few slides. All right, so a fascial component we want to talk about is the fascia lata, and this is a thick, deep fascia of the thigh that encloses its muscular compartments. And you can see that shown here. Here it's labeled in the diagram, fascia lata. This is very superficial. Deep to this would be the muscles and more of the vessels, and then eventually the bone. And so, this section right here is the fascia lata, and it encases the entire thigh. It wraps all the way around, and it functions to contain loose fluids, such as blood or other loose fluids within the thigh, and this, it prevents it from leaking into the knee, into the leg, or back up into the pelvis and perineum, because this would be your ACES right here. Just to orient your knee would be down here, pelvis would be here. So it keeps any kind of loose fluid within the thigh. It keeps it from leaking back into the pelvis and causing any problems in there, or leaking into the knee, because you wouldn't want it inflaming and flaring up the knee. It thickens laterally, and we'll show this more on the next slide, but more so in the lateral, to form the iliotibial tract, also known as the IT band or the iliotibial band. So the IT band, it originates from the iliac crest and then inserts onto the lateral condyle of the tibia. So here's the iliac crest. This is an anterior view. Here's coming here. Here's the ACES right here. And so actually here you can see it. Here's that tensor fascia lata muscle, which tenses the IT band, and it originates from the iliac crest as well. So you can see that where the band comes down here, and then it continues on down this way, and then inserts down here onto the lateral condyle of the tibia. So it crosses the knee joint, and it functions to really help stabilize the knee joint. Now, in a clinical disorder, is the IT band can become inflamed, and it's usually caused by either overactivity, so a lot of running, jumping, lack of conditioning, so someone who's out of shape and then they do a lot of heavy physical activity, or they don't have a proper warm-up before their activity. The way it'll present is it's pain on the lateral aspect of the knee during exercise. All right, so now to talk about the muscles. And just like all the other muscles we've been talking about in the body, is these muscles in the extremities are broken down into compartments. That doesn't change here in the thigh. So it's separated into three compartments by intermuscular septa. So we'll mark it right here. Here's your femur right here, kind of our center point. So you have your intermuscular septum here, giving you the anterior compartment, and then it comes out here like this. This is more proximal in the thigh, so the medial compartment is not too big. In the proximal portion, it'd become larger if we took this cross section more distal down the thigh. So that's the medial, and then the posterior compartment back here. Each muscle compartment has its own innervating nerve and major function. So the anterior compartment, the main nerve here is the femoral nerve. So most of the muscles here are innervated by the femoral nerve, and the main function of the anterior compartment is knee extension. Then you have the posterior, this is branches of the sciatic nerve. And the main function here is to flex the knee and extend the hip. And then on the medial side, this is the adductor compartment, and the main nerve here is the obturator nerve. And we'll go through this in much more detail in the subsequent slides. So first with the anterior compartment, like we said, it's innervated by the femoral nerve. It acts to extend the knees. So here's all the anterior compartment muscles, and as you can see, they all converge onto this quadriceps tendon, which then inserts onto the patella to then become the patellar tendon. So again, here's your quad tendon, and then here's your patellar tendon. And the patellar tendon inserts onto the tibial tubercle on the proximal tibia, and we'll talk much more about that in the knee lecture, but just to give you an idea. So if you notice, the quadriceps muscle is composed of 4 muscles, quad, 4. So here's your 4 muscles: your rectus femoris, which is here, your vastus intermedius, which is just deep to it, you can't really see it here, your vastus lateralis, which is right here, which is on the lateral aspect, and then your vastus medialis, which is here on the medial aspect. And if you'll notice, all these muscles, muscles contract, they shorten. They're all going to pull up on this quadriceps tendon. So it's really, you get pulling in several different directions, pulling on this patella, which then pulls up on the tibia. So then it crosses the knee joint, and that helps extend the knee. And on this cross-section view here you can see here's the rectus femoris, most superficial. Here's vastus intermedius, kind of right here over the femoral shaft, just deep to rectus femoris. Then you have vastus lateralis, which is right here, which is on the lateral aspect. And then you have vastus medialis, which is here on the medial side. So first, the iliacus muscle. So this originates from the upper 2/3 of the iliac fossa, and you can see it actually right here. It's kind of a sheet-like muscle that starts up here in the the pelvis area, and then it comes down into the thigh like this. So it originates up here in the pelvis and then travels down into the thigh. And then it inserts onto the lesser trochanter of the knee. So it's going to kind of go back around and insert on that lesser trochanter on the posterior aspect. Movement is that it flexes the hip joint, and that makes sense. It crosses the hip joint and it wraps around to go to the posterior aspect. So muscles contract, they contract, it's going to pull. So it's going to pull the hip up. Because remember, flexing the hip is pulling, in a sense, pulling the hip up closer towards your abdomen, not kicking back out. And then also medial rotation, and that makes sense because it's going to kind of pull this way, which would be medial rotation. So it's going to help with that as well. Innervation is femoral nerve. And one other thing I want to point out is that the iliacus combines with the psoas muscle, which also begins up here in the pelvis region, and then they kind of have a common insertion here on the lesser trochanter. And they could even be, sometimes they're called the ilio-psoas muscle. So the sartorius muscle, this is actually the longest muscle in the body, and it originates up here on the asus. So here's the asus right here, the anterior superior iliac spine. And it goes down, and it goes from lateral to medial. That's important to know. So lateral down to the medial aspect down here. And it inserts onto the medial surface of the proximal tibia, which would be down in here. And you can see that here where it wraps around, and then it inserts onto this tendinous structure here called the pes anserinus. And the pes anserinus is thought of as a conjoined tendon of 3 muscles. So the first one's the sartorius, and then the other 2 are in the posterior aspect of the thigh. So there's the semitendinosus, and then the gracilis. And so these three muscles have a common insertion point at the pes anserinus. So movements, there's several movements. If you notice, it crosses the hip joint here, and then it crosses the knee joint here. So it's one of those unique muscles that crosses 2 joints. And so it's going to contract, it's going to shorten, As far as the hip goes, it's going to flex, it's going to pull up this way. So it's going to help with hip flexion, and then lateral rotation of the hip as well, because it's going to kind of help pull out this way. So lateral rotation that way. And then also it crosses the knee joint, so it's going to help a little bit with knee flexion as well. And on this more medial proximal aspect here, it's going to actually pull more so this way, and so help with knee flexion. And then the innervation is femoral nerve. It's in the anterior compartment. That's easy to remember. Rectus femoris, so the first of those quadricep muscles, it originates from the anterior inferior iliac spine, so not the asus. And you can't really see that here. It would be more kind of in this region here, deep to sartorius here. And you can see rectus femoris coming out, emerging this way. It also originates from the ilium as well, so up in this region as well, deep to these other muscles. It inserts onto the quadriceps tendon because it's one of the quad muscles, and then via the quad tendon inserting on the patella, and then the patellar tendon inserts onto the proximal tibia as well. But really, you want to think about the insertion for these quads is the quadricep tendon and then that essentially, if you want to think about a bony insertion, to be on the patella bone. Movement, again, all the quads, they contract, they're going to pull across the knee joint, extend it. Also assists a little bit with hip flexion due to this, more proximal origin up here. So again, it can help flex the hip as well. But again, major function is knee extension. It's an anterior compartment muscle, so it's a femoral nerve innervation. Vastus medialis, you can see that right here on the medial aspect, has these kind of winding fibers in like this. Originates from that linea aspera on the posterior aspect of the femur, so that ridge we pointed out on the skeletal model. The insertion is the quadriceps tendon, just like so all the other quad muscles. So here, inserts on the patella. Movement, it's just like the other quads. Contract, it's going to pull. Knee extension, it's an anterior compartment muscle, femoral nerve. Vastus lateralis, so it's on the lateral aspect here. Coming again, it also originates from that linea aspera, the lateral lip you could think of, and the intertrochanteric line, so that line that connects the two trochanters, and then also the greater trochanter of the femur. So 3 origin points right here. Common insertion of the quadriceps tendon, movement, knee extension. Again, it's going to pull across that knee joint. It's an anterior compartment muscle, femoral nerve. Vastus intermedius, it's deep to this muscle here, so it'd be in this region here, just deep. Anterolateral surface of the proximal femur, so that's where it's going to originate from. And then again, quadriceps tendon, knee extension, femoral nerve. You get the idea. So the posterior compartment of the thigh. So again, we'll show this here. This would be your posterior compartment here. And it's innervated by the tibial division of the sciatic nerve. So the sciatic nerve is a huge nerve, and you'll see that in the cadaver lab. And it has 2 divisions. It has a tibial division and then a perineal division, or a fibular division, depending on who you talk to. And the main functions of the muscles involved in the posterior compartment of the thigh is to extend the hip joint, so out this way, because this is a posterior view. So these are all your muscles here. And then also to help flex the knee, because you can see here a lot of the tendons here are crossing the knee joint right here. This would be your knee joint right here, and helping pull this way. So the anterior compartment extends the knee, posterior compartment flexes the knee. So first, the semitendinosus, and you can see that right here. So this is the semitendinosus, this most medial muscle here. Has this tendon that comes down like this. So here's the tendon here. We'll say T for tendon. Comes down this way. And it originates from the ischial tuberosity up on the ischium bone in the pelvis here. So it originates up here. And then it inserts onto the medial aspect of the proximal tibia via that pes anserinus. And so you can see that here where it's coming down, and it'll form that common insertion point with the gracilis and then the sartorius muscles as well. Now, hip extension, it crosses the hip joint, because you can see up here in this proximal region of the muscle, so it helps extend the hip out. And then knee flexion, so it crosses the knee joint. So again, this muscle, it's going to contract like this, contract, and so it's going to pull this way. It's innervation, tibial division of the sciatic nerve. It's a posterior compartment muscle. So we're going down the line here. So this is semitendinosus. This is semimembranosus. So it also originates from the ischial tuberosity up here. And then the insertion point is the medial tibial condyle. So as you can see down here, here it is right here. Here's the tendon coming in here. And it is not part of the pes anserinus. And so it just inserts onto the medial tibial condyle. So it crosses the knee joint. And so again, it also crosses the hip joint due to this origin up here, and it helps with hip extension, just like semitendinosus. And then it also helps more so with knee flexion, because again, this muscle, it's going to contract, and it's going to pull the knee this way. It's a posterior compartment muscle, so tibial division of the sciatic nerve. So biceps femoris, it has 2 heads. It has a long head and a short head, and you can see the long head really nicely here. And the long head originates from the ischial tuberosity, just like semimembranosus and semitendinosus. So here's semitendinosus, and then here's semimembranosus. So just to kind of get you, spatially oriented here. They all originate up here on this ischial tuberosity, so it's a common origin point for these 3 muscles. The short head originates from that linea aspera of the proximal femur. So the short head, you can kind of see it, ducking out right here. It's just deep to this muscle belly. It comes off that bony ridge on the posterior aspect of the femoral shaft. They both insert onto the fibular head, so you can see that where this common insertion point right here. You could think of it as 2 muscles because it has 2 origin, but they have, it's really considered one muscle because they have this common insertion point right here. They kind of merge together more distally here and then insert onto the fibular head. You can see the tendon coming in here. So both heads, they both flex the knee. So, muscles contract, they contract. It's going to pull up on the knee because it crosses that knee joint. Now the long head, since it comes up here and has this origin with these other muscles that also cross the hip joint, so just like those, it also crosses that joint, and so it also helps with hip extension. Innervation, now this is a dually innervated muscle, very important. So the long head here is the tibial division of the sciatic nerve, and then the short head is the perineal division of the sciatic nerve. So they're both sciatic nerve, but just different divisions of it. So this is an important distinction to be aware of. So one thing I want to point out here with the posterior compartment is that you've heard the expression, I've pulled a hammy or I pulled a hamstring. So there's no single hamstring muscle. Hamstring muscles is a group of muscles here in the posterior compartment. And it's the semitendinosus, it's the semimembranosus, and then it's the biceps femoris here. So these are the three hamstring muscles. Okay, and that could be a test question on an anatomy exam. So definitely want to be aware of that. So now the third and final compartment, the medial compartment. This compartment is solely innervated by the obturator nerve, and the only function really is to adduct the hip, so pull the hip closer to the midline. So adductor longus is the first muscle we're going to talk about, and it's this big sheet-like muscle, as you can see here, and it originates here from the pubic body. This is an anterior view, medial compartment. This is medial, this is lateral. And so it originates from this pubic body, and then it inserts onto that linea aspera. So it comes down here and then inserts onto this posterior aspect of the femur. Now the main function is hip adduction. That makes sense. You know, muscles are going to contract, they're going to contract, it's going to pull towards the medial or the midline. When it pulls up in this area here, it's going to help with flexion of the hip as well. It's a medial compartment muscle, so it's the obturator nerve. So adductor brevis is just superior to adductor longus, and that's shown here. Inferior pubic ramus, and then also the pubic body, so up in this region as well. Same insertion point as the adductor longus, linea aspera of the femur, so that posterior aspect. Same function as well. It's a very similar attachments, similar region. So again, muscles contract, they contract. It's going to pull towards the midline here. Also crosses the hip joint, so it's going to help with some flexion of the hip. It's a medial compartment muscle, so it's obturator nerve. So adductor magnus, this is a little more complex muscle. It originates from, and you can see, here's this portion right here. The proximal portion is going to run up here and originate from the inferior pubic ramus and then the ischial tuberosity, so more in the posterior portion. And then it's going to insert onto, it's going to insert here where the other ones do onto linea aspera, because this is adductor longus. Here's brevis. And then it also is going to insert onto that adductor tubercle of the femur. So that, as you can see here, it's even labeled for you in the diagram. So it's that bony prominence on the medial aspect of the femoral condyle. So right here, so that adductor tubercle, so that's the other insertion point. And it's going to help with hip adduction. Obviously, it's a medial compartment. Muscles contract, pull towards the midline. The adductor portion. So there's an adductor portion, which is more originating from the inferior pubic ramus up here, more anteriorly. This is going to help with hip flexion. So since it's crossing the hip joint, it's more anterior here. Like the anterior muscles of the thigh, it's going to help with hip flexion. So, but then there's also the hamstring portion, which more originates from this ischial tuberosity, like many of the other posterior muscles. And so that part of the muscle is actually going to help with hip extension. So this is important to know where the different movements here. And the way you can keep this straight is just remember the adductor portion. It has more of a anterior compartment or more of an anterior course, and then the hamstring portion is going to be more of a posterior origin and then a posterior course, so that it's going to act more like a posterior muscle. And so the innervation, the adductor portion, is going to be obturator nerve. So that makes sense. And then the hamstring portion, again, it's like a posterior compartment muscle almost. So it would be the tibial division of the sciatic nerve. That's what would be innervating the hamstring portion. So let me go back this up here so I don't forget. I'm just backing this up because I want to mention something on the posterior compartment about the hamstring muscles. That should have been mentioned. So one thing I also want to point out here in the posterior compartment is that, you hear often, I pulled a hammy or a hamstring muscle. And the hamstring muscles it's a group of muscles. There's no single hamstring muscle, as you probably have cut. So one thing I want to point out here on the posterior compartment is you've probably heard the expression, I pulled a hammy or I pulled a hamstring. So there's no hamstring muscle. The hamstring muscles are a group of muscles here in the medial and posterior aspect of the thigh. And so it's cut. So one thing I want to talk about here real quickly is that you may have heard the expression, I pulled a hammy or I pulled a hamstring. So there's no single hamstring muscle. The hamstring muscles is kind of like the quadriceps, is a group of muscles in the posterior aspect here of the thigh. And so it's three muscles. It's the semi-membranosus, and then it's the cut. So one thing I want to point out here real quickly is that you probably heard So one thing I want to point out about the posterior compartment as we finished here is that there's no single hamstring muscle. You've heard the expression, I pulled a hammy or I pulled a hamstring. So the hamstring muscle is actually cut. So one thing I want to point out here with the posterior compartment is that you've heard the expression, I've pulled a hammy or I pulled a hamstring. So there's no single hamstring muscle. Hamstring muscles is a group of muscles here in the posterior compartment, and it's the semitendinosus, it's the semimembranosus, and then it's the biceps femoris here. So these are the three hamstring muscles. Okay, and that could be a test question on an anatomy exam. So definitely want to be aware of that. And often people also kind of like to test that because it's something you hear about in everyday culture, and so even non-medical people have heard the expression of hamstring. So it's important to know what a hamstring muscle really is, and so don't be surprised if you get tested on it. So the pectineus muscle, this is a more superficial view here. So those other images we've been looking at is, these muscles cut away so you can see those adductor muscles. So the adductor muscles would be just deep to the pectineus muscle here, which is shown here. In fact, you can see adductor longus here, just the proximal portion of it before it would go on to attach the medial aspect of the femur. So it's in the name here, pectineal line of the pubis to the pectineal line of the femur. So we talked about that in the skeletal model. So it's pectineal line to pectineal line, pectineus muscle. So it's easy to remember those attachments. It helps adduct the hip. It's a medial compartment. Also, it makes sense. Muscles contract, pulls this way. Also flexes the hip because it's located up here near the hip joint as well. It can help pull the hip up this way. Innervation, this is unique, is a femoral nerve. So this is an exception to the other adductor muscles here. All right, so for gracilis here, we're back to this posterior view that we used to talk about the posterior compartment. Here's biceps femoris. Here's semitendinosus. Here's semimembranosus. And then this third muscle here is it's not a posterior muscle. This is gracilis. And you can see it here coming down the medial aspect. And you can even see it labeled here. Here's the tendon coming right here. And this is the third muscle we're going to talk about here of the pes anserinus. So it attaches onto, and you can see here, forms that tendinous insertion here on the medial aspect of the proximal tibia. So it's the pes anserinus. So again, to review, it's sartorius, semitendinosus, and then gracilis. Those are the three muscles for pes anserinus, and they have this common tendinous insertion point. And since it crosses the knee joint, it actually helps with knee flexion. Because of this insertion, it's more knee flexion than so much hip adduction, but it does help with that because it's in the medial compartment. And also pulls on the hip as well to help medially rotate, so it would be internal rotation like that. And it's a medial compartment muscle, so it's an obturator nerve. And so obturator internus, we've got a real nice view of it right here. So this is an anterior view. Here's your bony pelvis right here. Here's your pubis right here, your ischial tuberosity here. Here's your proximal femur here, greater trochanter here, iliofemoral ligament. And so here's a beautiful view of the obturator externus here. So it originates from that obturator foramen and membrane. So this all around here, formed by the bony pelvis, is the obturator foramen. And then also, as you know, the obturator membrane covers most of that foramen. So it originates from both the bony part and the membranous part. It inserts onto the trochanteric fossa of the femur, so it wraps around here. It has this insertion on the posterior aspect. Movement is hip adduction. Again, muscles contract, they contract. It's going to pull towards the midline here. And then it also helps with some lateral rotation because it also inserts where a lot of the lateral rotators of the hip insert. So if it's going to pull this way, it's going to pull on the hip, it's going to pull it out that way, which would be lateral rotation. It's a medial compartment muscle, so that's going to be obturator nerve. All right, and so that closes out our discussion of the thigh muscles. In the next lecture, we're going to spend an entire lecture going through all the blood vessels in the thigh region and in the femoral triangle as well.